In this video, I'm going to talk about morning sickness. So morning sickness and pregnancy go hand in hand. If you're pregnant, you've definitely heard about morning sickness. Morning sickness refers to the nausea and vomiting that is experienced by pregnant women. Morning sickness is very, very common. 7 out of 10 women may experience morning sickness. So the term morning sickness is actually a misnomer. Morning sickness does not necessarily happen only in the morning. You may have this feeling of nausea and vomiting anytime in the day or even at night. So morning sickness usually starts in the first month of pregnancy, and by the end of first trimester, that is by the end of the 3rd month, most women start feeling well. Some women, however, continue to have this feeling of nausea and vomiting, which can last throughout pregnancy. Now, if you do not have morning sickness, does it mean anything? Not at all. Many women with healthy pregnancies experience absolutely no morning sickness, and I would say that's lucky. So if you have or don't have morning sickness, do not worry, it does not have an impact on your pregnancy. So why does morning sickness happen? It is mainly because of hormonal changes that happen in early pregnancy. It can also be because of low blood sugars and also because of altered carbohydrate metabolism. So does morning sickness have an impact on your baby or on you? If the morning sickness is mild, it will absolutely have no impact on the health of your baby or even on you. If you have severe nausea, severe vomiting, you are not able to keep down even water, if you are dehydrated, then it can be a problem and you definitely need to visit your gynecologist. So what are the symptoms and signs of dehydration? If you're not able to drink water or keep down water, which is making you not drink water at all, if you're passing very less urine, or if the urine is very high colored, if your heart is pounding, as in if you're feeling palpitations, or if you're feeling giddiness or having loss of consciousness, these are the symptoms of dehydration. And if you have a lot of nausea and vomiting and any of these symptoms, you definitely need to visit your doctor. Twin pregnancies, fertility treatments sometimes are associated with more nausea and vomiting because of the hormonal changes that are associated in these conditions. So what to do if you have morning sickness? Ideally, you should try and avoid the triggers that lead to this nausea and vomiting. Many women have a heightened sense of smell or going into the kitchen, which triggers this nausea. So if you can avoid cooking for some time, if you can avoid taking out the garbage, if these are your triggers for the feeling of nausea and vomiting. It is always better that when you get out of bed in the morning, you eat a dry biscuit or a dry toast. You have to try to keep yourself well hydrated. Drink plenty of water, drink lemon juice or drink ginger tea. Your diet should be a carbohydrate and a protein diet. You need to avoid eating spicy, oily foods because these will lead to increased acidity, heartburn, which can in turn lead to increase in nausea and vomiting. Most of the times these home remedies help, but if the home remedies are not helping, you definitely need to seek help from your doctor, who will give you vitamin B6, will give you probably doxylamine and maybe some antiemetics. It's always advisable not to take over-the-counter medication for simple nausea vomiting because all medicines are not safe in the first trimester. You should seek help and seek advice from your doctor if you have nausea and vomiting of pregnancy.